Good evening, and thank you all for joining us tonight for our webinar, New Approaches to Facial Rejuvenation with Dr. Kevin Pinski. A little bit about Dr. Pinski. He is in private practice in downtown Chicago. He attended Northwestern Medical School and is now an assistant professor of dermatology at Northwestern University. He's a past president of Noah Worcester Dermatological Honor Society, and he is the director of Pinski Dermatology and Cosmetic Surgery. Dr. Pinski is also an author and contributor of numerous clinical articles and books, an internationally recognized speaker and presenter, and is a renowned expert of facial rejuvenation with laser, Botox, and fillers. Dr. Pinski has had the Aerolase Neo since 2015, and he is also a member of the Aerolase Medical Advisory Board. Also, if you have any questions at any time, please feel free to type it into the box, and we will try to get to as many of the questions as possible at the conclusion of the webinar. For any questions that do not get answered, we will follow up with you afterwards. Thank you. So without further ado, I'm going to turn it over to Dr. Pinski for the remainder of the webinar.
Thank you very much. And I'd also like to thank you all for attending the webinar this evening and taking time out of your busy schedules. We'll start first talking about anti-aging facial treatments in regards to aging skin and the aesthetic consumer. These treatments are certainly in high demand these days. Practitioners are choosing to offer facial laser rejuvenation in medical practices because our population is aging, people are living longer, people pay to look younger, and laser facial rejuvenation treatments have become an aesthetic staple in our regimens. We have an increasingly demanding clientele. There is an increasing demand for non-invasive treatments. No downtime procedures are an absolute must. We need to obtain natural-looking results. Patients want improved tone, texture, tightening, and blemish and hair removal. So we're looking for an all-encompassing improvement. Patients have high expectations for results, and they are becoming more educated and more knowledgeable. We've got various growing segments for facial aesthetics, primarily the younger generation. There's greater access to information about cosmetic procedures through social media and celebrity influences. This is the age of the selfie. Photos predominate in social media and in communications. These patients now have discretionary income to spend on procedures and products. And it's considered more of a social norm to have facial aesthetic procedures. Patients are certainly increasingly aware of preventative aging, most importantly. Male population. Men are now seeking to regain a more youthful look and improve their self-image and feel better about their appearance. Male cosmetic procedures have risen more than 43% in the last 5 years. Aesthetic medicine is really making a large push to cater and market to men as their interest in aesthetic procedures rise. Also, in the population of skin of color, 80% of the world population happens to be in this population with skin of color. These patients account for 30% of all U.S. cosmetic procedures these days. The demand has increased for cosmetic procedures for more even skin tone, reduction in signs of aging, and skin laxity. 1 in 3 skin of color patients are demanding cosmetic treatments. The advancements in technology and skincare allow for more safer, more effective treatments and have helped to drive this demand and availability for skin of color patients. The demand for cosmetic procedures for this segment of the population is expected to continue to soar in the next decade. So what are common facial concerns that we deal with when talking about laser rejuvenation of the face? Aging skin, encompassing tone, texture, wrinkles, laxity, scars. Pigmentation, sunspots, or also known as age spots, melasma. Vascular lesions, including spider veins, rosacea, poikiloderma. Also unwanted hair and pseudofolliculitis barbae, or ingrowing hairs, and lastly, also active acne treatments. Laser rejuvenation can now address many of patients' top concerns. In fact, as you see from this little bar graph, these are 5 of the top concerns that patients currently have: excess weight, skin texture or discoloration, lines and wrinkles around the eyes, excess fat under the chin or neck, and sagging facial skin. Lasers can now address 3 of these top 5 concerns, and in fact, we can do it with one device, as we're going to talk about. What have been some of the limitations of traditional skin rejuvenation? Well, historically, complete rejuvenation required multiple devices or multiple handpieces. This involved then more time for treatment, increased cost, and there's also then potential space requirement issues. Also required patient downtime. There were few treatment options for darker skin types, and multiple treatment sessions typically were required so as not to overstress the skin and increase downtime. So what was my practice like before the implementation of LightPod Neo? Well, 60 to 70% of my practice focuses still on aesthetic treatments. I see about 50 to 70 patients each day, ranging from pediatric to geriatric, and I treat all skin types from 1 to 6. I have approximately 14 other lasers or devices that are utilized in my practice. As most of you, I prefer devices without consumables. I prefer devices that are safe and effective on all skin types, and devices that result in minimal downtime. I also prefer devices that are safe and predictable so that they may be delegated to a physician extender. And I do combine multiple procedures. For instance, I combine laser and injectables occasionally in a single session. What's happened now that we've implemented Neo LightPod laser into our practice? Well, it certainly has streamlined our laser operation. It's eliminated the need to utilize multiple devices for complete facial rejuvenation. It's increased our treatment efficacy while also increasing our patients' treatment comfort and satisfaction. It has somewhat revolutionized the way we treat acne, also veins and redness of the face, and tone and texture. It's opened up new treatment avenues for our patients of ethnic skin or skin of color. It has decreased our operational costs. We found that this device is exceptionally easy and it's reliable. We've been able to delegate it actually to physician extenders. In short, it has become a laser of choice for numerous applications, and it's become a great adjunct to our increasingly already busy practice. Many of you have seen this type of absorption spectrum previously. It just shows essentially where the neodymium YAG technology, or 1064 nanometer, fits in. It's highly versatile. It's absorbed by hemoglobin, melanin, and water. So it is it has a nice position in our spectrum here. It's a unique technology in that in the past, typically energies were delivered with high power and long pulse width. Problem in doing so is that patients would often get treatment discomfort with that increasing pulse width exposure. With LightPod Neo, it's high power delivered in a very short pulse width or short exposure, 15 to 30 milliseconds typically for neodymium YAGs laser, whereas this is 650 microseconds or 0.65 milliseconds, much shorter exposure. Because of this, it is a much safer and much more comfortable procedure. Higher power and a short pulse duration confines the heat to its desired target. As you see here on this slide on the left, diagrammatic of a hair follicle. Longer pulse durations will typically cause heat to dissipate in the surrounding skin, risking adverse effects, discomfort, and then the need also for numbing or cooling agents. So again, with this unique technology, we're delivering a safer, more comfortable exposure of higher power, 650 microsecond pulse, which passes through the epidermis in approximately 1/50th of the time versus a 30 millisecond pulse. Heat is then confined to the target. So we've got higher efficacy at same fluences with a higher margin of safety. Therefore, we've opened up newer applications which previously were not feasible with the previous long pulse lasers. It's really the whole premise behind Aerolase Neo. So this is really, in my opinion, a new standard for skin of color. 1064 nanometer or YAG laser is really the gold standard for treating ethnic skin. It's often referred to as the color-blind laser. Sufficient power and a safe pulse duration. We can deliver high power and efficacy with little to no side effects. We use a long wavelength, deeper penetration into the dermis, moderate, not too high, melanin attraction, so we avoid overheating the epidermis, which is especially important on skin of color. So, various ways that we utilize this and what has been our success with it. Well, veins and redness. With a single 30 to 45-minute treatment, we can improve these issues. Typically, prices range anywhere from $300 to $850 per session. It's immediate results, dramatic improvement seen over time with subsequent treatments. Usually, with our protocol, we'll repeat treatments every 3 to 4 weeks, approximately 3 to 4 treatments depending on the severity of the patient and desired outcome. We've got the ability to treat patients of all Fitzpatrick skin types 1 through 6. It again targets both deep and superficial structures for addressing the superficial redness as well as angiomas, spider veins, and other vascular lesions. It's not as harsh as pulse dye lasers. It does not induce purpura, swelling, or other side effects that we may typically see with these pulse dye lasers. And in my opinion, it's as, if not more efficacious as these other devices which target hemoglobin. An example of one of our patients with rosacea and facial erythema before and after one treatment. As previously stated, this laser is also very nicely used to improve tone and texture. Again, a single 30 to 45-minute treatment session can be priced anywhere from $300 to $850. Immediate results, dramatic improvement seen over time with subsequent repeat treatments. Typically, we schedule these about 2 to 4 weeks apart, again, 3 to 4 treatments, depending on severity of the patient and desired outcome. Again, we are able to treat patients with all skin types 1 through 6, targeting both deep and superficial structures for comprehensive facial rejuvenation. We tailor the treatments to address each patient's individual skin concerns, and certainly it can be combined with other treatments such as toxins, fillers, or chemical peels within that same treatment setting. This is an example again of one of our patients prior to any treatment at all for facial rejuvenation. She wanted improvement both of tone and texture, and this is her after 5 treatments done every 3 to 4 weeks. She was also on glycolic acids, lotion topically, and retinol. No fillers or neuromodulators were done during these sessions or between photographs. I think it's a typical but very significant result. How about acne? Single 10 to 15-minute treatment session. These are priced anywhere from $300 to $850 per session, again, depending on the extent of treatment. Immediate results, dramatic improvements seen over time with subsequent treatments. Typically, our protocol involves treating 1 to 3 week sessions, and anywhere from 3 to 6 treatments, again, depending on severity of the acne. Again, we can treat patients of all skin types, 1 through 6, and it treats both active lesions, and it prevents onset of future breakouts by decreasing sebum output. This tends to eliminate side effects from a lot of potential systemic therapies. It does offer a treatment solution for patients who have not responded to or do not want to take oral medications. It has been more effective and consistent, in my opinion, than some of our other treatments that we do use, including PDT, photodynamic therapy, or IPL devices. Some examples. This is a patient of ours with acne after 3 treatments. He had sessions spaced out 2 weeks apart. Most commonly, it is not a monotherapy. He was also on glycolic acid cleanser, glycolic acid lotion, azelaic acid gel topically, and Solodine. Another patient, after 1 treatment, also she was concomitantly being treated with glycolic acids topically, glycolic acid cleanser, tretinoin 0.05% cream, and Septra orally. Most of these patients have tried multiple treatments and have failed, or they are not sufficient. They want further improvement, or they have additional PIH that they would like to improve as well. This is a patient with extremely bad acne, cystic lesions as well as more superficial lesions, middle-aged Caucasian woman. After 7 treatments spaced out 2 weeks apart, this is her after on the right. She was also being treated with Klenia wash, metronidazole lotion, Tazarac cream, Soolantra, and Duracef 500 milligrams q.day. After being through various other regimens of systemic antibiotics, this seemed to be the one treatment that really put her in the positive direction. And this is a patient with very extensive acne, some scarring as well as post-inflammatory hyperpigmentation. This is after 7 treatments done every 2 weeks. Again, she was also being treated with concomitantly Sumidin wash, Onextin, QHS, Tazarac cream, q.day, and Septra, with I think an excellent result. Of interest, as of this past June of 2016, we had treated almost 110 patients with the LightPod Neo laser for various reasons, and the results for patient satisfaction have truly surpassed those from any other device that we have used for a number of conditions. Acne, we had approximately 70% of our patients that had a moderate to high satisfaction rate. For facial rejuvenation, 100% of the patients had a moderate to high satisfaction rate, with 67% of them rating it as highly satisfactory. For off-face rejuvenation, 83% gave it a ranking of moderate to high satisfaction. Again, 67% or 2/3 of them ranked it as high satisfaction. Melasma, 75% gave it moderate satisfaction, and laser hair removal with this device, 100% of the patients stated that they were highly satisfied. I've mentioned that this can be combined with other modalities. Due to the unique gentleness of LightPod Neo, it allows us the ability to combine it with peels, with injectables, within a single treatment session for, I think, really amazing results of complete facial rejuvenation with no downtime. An example, for facial rejuvenation on skin of color, one can combine the LightPod Neo treatment followed immediately by a 50% glycolic acid peel. It also reduces the risk of post-injectable bruising, or it can help clear bruising quicker if that develops because of injections. So for combining it with injectable procedures, we see promotion of collagen remodeling due to the laser in the dermal layer. It also helps promote skin tightening and diminish laxity, removes pigmentary conditions at the dermal level, removes any vascular conditions and unwanted hair. It helps to also treat acne, and we've talked about all of this. Injectables obviously help to increase dermal volume and fullness and decrease deep wrinkles and sagging skin. So this combination can promote complete skin rejuvenation as well as tightening and revolumization. And this is an example of a patient who was injected with fillers, developed ecchymosis or bruising, was treated then with the Aerolase device, and this shows her 2 days later with significant reduction of the sequela. Another patient treated with both Aerolase and Bellatero for under-eye discoloration and infraorbital hollows, and this is after one treatment with this combined approach. About combining it with chemical peels, as previously mentioned. With the laser, again, we get promotion of collagen, remodeling again in the dermal layer, promoting skin tightening, diminishing laxity, improving pigmentary conditions and vascular conditions. With the chemical peel, we will generate new epidermal tissue to remove superficial wrinkles, pigmentary concerns, and other textural concerns. So again, we're promoting a complete skin rejuvenation, tightening, brightening, by refreshing both dermal and epidermal layers. And this is an example of such as treated by my good friend Cheryl Burgess, a patient with melasma and some textural issues. One treatment combining glycolic peel and Aerolase in the same session. All right, let's give you an actual example of Aerolase with this video. So again, it's a very comfortable procedure. The patient does not need any anesthetic or analgesia. Afterwards, the patient can return back to normal activities. There is no downtime. And this is a patient with mild to moderate acne. The laser heats up the affected area to help kill the bacteria and help shrink sebaceous glands, which will cause them to produce less sebum, limiting, again, future outbreaks as well as helping reduce pore size to an extent. The nice thing, again, patients of any skin type can be treated with really any degree of acne. It can be beneficial, especially mild to moderate, but as well severe and cystic acne, as I've shown you examples of. Typically, we'll make about 3 passes on the skin, followed by spot treatment of individual acne lesions. When we're actually treating the individual lesions, we're usually using a smaller, more focused area, 2mm lens versus a 6mm lens for skin types 1 to 3. And then we'll make 3 to 5 pulses on these smaller lesions, 5 to 15 pulses on larger cystic lesions. Darker skin types will typically stick with the 6mm lens and make about 3 passes. And our endpoint is you'll actually see these lesions changing from red to white or a little bit darker in the darker skin types. And then in addition to improvement in acne, patients are certainly finding improvement in overall quality of their skin, improvement in texture, tightening, as well as tone. And I think we see this pretty much across the board with this laser for the various reasons that these patients are being treated. So in summary, LifePod Neo really is a game changer. It enables a broad range of neodymium YAG applications for safe and effective use on the face as well as off-face areas, neck, décolleté, hands. It enhances an already versatile and effective wavelength for new applications. Cooling and anesthetic-free treatment of all skin types without actually touching the skin, thus eliminating the risk of burns and other adverse effects, and increased patient comfort. There's over 30 FDA-cleared applications targeting all chromophores with a single device and handpiece. It therefore eliminates the need for multiple heads or multiple devices. This therefore translates into cost savings, improved space requirements, improved usage. One device is required with a small footprint, but it's really a workhorse to help support your practice. It enables multi-location use as well if desired. I think it's been an amazingly effective treatment with great results, great, repeatable, consistent patient satisfaction. Truly, I think, advanced my practice. It has helped streamline our laser operation. It's eliminated the need to utilize multiple devices for complete facial rejuvenation. It's increased our treatment efficacy while also increasing our patients' treatment comfort and satisfaction. I definitely think it has greatly helped revolutionize the way we treat acne. It's also helped with veins, redness, tone, and texture. It's opened up new treatment avenues for our patients with ethnic skin. And it's definitely become a laser of choice for numerous applications, and it's become a great adjunct to our increasingly busy practice. And we're so comfortable with it, again, it's a device now that I can rely on my paramedical position extenders to utilize, thereby increasing our practice revenue. So I think with that, I'd like to close, but I'm happy to entertain any questions that you all may have. Thank you again for your attention this evening.
We have a couple of treatment questions as well. We have one question wondering if it is useful for lower extremity spider veins, onychomycosis or nail fungus, or melasma in the Latin population.
Well, let me address the last part of that question first, melasma. Yes, it is a useful modality for melasma treatment in, I think, all skin types, 1 through 6, which is why, again, I think this has been a very useful addition to our armamentarium with other modalities. And I, for a lot of these things, I don't look at this necessarily as just a monotherapy, which is part of the beauty of what we do these days is we use combination therapy. But this has certainly aided us in treating a very difficult entity like melasma.
All right, excellent. So a couple other questions here. I know you already addressed this a couple times, but in terms of skin of color, do you have any incidences of adverse reactions, and how safe is it really for skin of color?
So it's very safe for, again, types 1 through 6. However, you do have to be careful. As we all know, skin of color has a greater tendency to hyperpigment when stressed. It comes with a 6 millimeter, a 5 millimeter, and a 2 millimeter lens. We don't want to use that 2 millimeter spot size in treating darker skin types. If we overheat their skin, overstress it, we do run a risk of developing pigmentation or PIH, post-inflammatory hyperpigmentation. Other than that, I find this to be a very safe and useful device for treating skin of color for various modalities.
Okay, and then there was a couple of questions about combination treatments. One was in terms of the protocol for combining with chemical peels. They wanted to know if you do the laser treatment first and then immediately do the chemical peel.
Right. So, Dr. Burgess has talked a lot about this particular combination, Cheryl Burgess, and using laser first, like Aerolase Neo, and then following with a chemical peel after, particularly glycolic acid peels. I personally have not combined it in that fashion. I do like some of the clinical photos that I've seen from her. They're actually very impressive. In fact, we showed one of them here in this webinar with just one treatment in hyperpigmentation melasma on a darker skin type patient. In addition, I think it could be utilized for other skin diseases or issues as well in that fashion. I have also seen and used it in combination with fillers, and it can be combined safely, especially as you saw in this webinar. I believe it was a patient of Dr. Michael Gold's to help eradicate post-injection purpura. One of the common questions that comes up is this deleterious then to fillers or neuromodulators to use devices like this immediately afterwards or shortly after even? And the answer is no. That's actually been published and looked at very carefully by Dr. Mitch Goldman and others. I believe the Carruthers also published an article in regards to that, using IPLs, broadband light, as well as radio frequency and Ulthera or focused ultrasound post injections of fillers and or neuromodulators. It does tend to be safe and does not decrease effects or duration.
And in terms of any injectables that you prefer to combine with laser?
Wow, that's a real difficult question to answer because I use all fillers, deep to superficial. I don't think I would say that I have a favorite combo. It just depends on that particular patient and what we're trying to improve.
Okay, so a couple other questions. You had mentioned in the beginning of the growing segments, one of these segments was men. What kind of treatments do you find that men are actually looking for?
Sure. Well, years ago, we didn't see a whole lot of men coming in for cosmetic issues other than hair transplants early in my days. But now they're coming in for virtually everything that the women are coming in for, which is great. I think it's still an untapped market relatively, but it's ever increasing statistically. And I guess specifically in regards to this webinar, the Aerolase, we see male patients coming in for acne and photoaging more than pigmentary issues predominantly.
All right, excellent. And then since there was a significant focus on acne, there are a number of questions on acne. One being, does it work for comedonal acne?
Yes, it does. It works, I think, for comedonal as well as inflammatory, and surprisingly to me is that it has worked as well for cystic acne lesions.
And then what if a patient has been using a retinoid? Do you make them wait, or can you treat them? I mean, how do you go about that?
Well, I don't think that it's always necessary to stop the retinoid before these treatments. As a matter of practice, however, we do have them stop at 24 hours before and after, very similar to what I do with my patients in their chemical peels. I just think oftentimes they may be a little less tolerant of the procedure, the laser procedure. The skin may be a bit more reactive if using the retinoid immediately prior to and immediately after.
All right. And then keeping in mind that the neodymium YAG does react to the three chromophores, hemoglobin, melanin, and water. When you're treating acne, do you also find that it will kill hairs and do some hair removal over the affected area?
Yeah, that is an issue. Predominantly when we're treating our male patients, and they have to be forewarned about that. At least for darker hair. Now, for lighter blonde or gray hair, not so much the issue, but in darker hair, you are going to get some hair removal when treating acne.
Okay, excellent. Okay, I'm just going through, see if there are any more questions out there. And again, we're kind of running out of time, and so if we did not get to any of your questions, we will address that afterwards, personally through you. So with that being said, Dr. Pinski, thank you very much for your expertise and input tonight.
Thank you very much, Sean. I appreciate it, and thank you all for your kind attention and tuning in.
All right, and everyone that has joined us tonight, thank you very much. We will email you the recording once it's done later on this week. And again, we'll get to your questions. If you have any others in the meantime, please don't hesitate to contact us at information@aerolase.com or our website chat box. Okay? Everyone have a great night. Thank you.